synthesis of a multidimensional assessment from a culturally competent perspective. There are 4 areas that we felt that needed to be addressed. First and foremost is this epidemic attacks a largely Caucasian population aged 18 years and older. This was evidenced by statistics and references we gathered and presented. In 2015 alone, 1.9 million people were diagnosed with an opioid use disorder. These rates are alarming. We also identified the many disparities within this disorder. And for those that are victimized by such, there are given protective and risk factors with such a cause. It has been noted that Caucasians are more able to be prescribed opioids. It has also been noted that there's an age disparity among older adults, specifically 45 to 55 years of age. Competency levels. As professionals, we have to be aware of our wording, how direct the questions are, how personal, and the individual's level of understanding. A lot of the questions in the biopsychological assessment are addressing factors in the psychological, environmental, biological, and social settings. We need to be aware of the sensitivity of certain cultures and ethnicities, and understanding that we might not be able to get a full evaluation of the client's upbringing, family history, let alone their own history. Lastly, there is not one sole cause for opioid addiction, and there is not one sole technique for helping alleviate this addiction. Prescription happy doctors play a role, as well as mental health and comorbidity. We can't rule out risk factors in the environment they are raised in, and there is so much more to consider when it comes to opioid use disorder.